Opportunistic salpingectomy means removing the fallopian tubes during another abdominal surgery that you're already having. This could be a gynecologic surgery, such as a hysterectomy, or a non-gynecologic procedure like removing your appendix or gallbladder, or even a urologic surgery on your kidneys or bladder.
Ovarian cancer affects about 1 in 70 women in Canada. Despite improvements in treatment, it's still a major cause of death in people with gynecologic cancers. Unlike breast cancer, which can be screened with mammograms, there's still no reliable screening test for ovarian cancer. In addition, early symptoms are often vague and non-specific. As a result, many people are diagnosed at an advanced stage of the disease. Research now shows that the most common and aggressive form of ovarian cancer, high-grade serous carcinoma, often begins in the ends of the fallopian tubes called the fimbriae, rather than in the ovaries themselves as previously believed. Removing the fallopian tubes after they're no longer needed can significantly lower the risk of ovarian cancer. While it does not eliminate the risk completely, recent studies showed that this practice reduces ovarian cancer risk by 80%, which is substantial. As a gynecological oncologist, I frequently see patients diagnosed too late. If there is a safe way to reduce the risk of this cancer, I strongly support it.
The main function of fallopian tubes is to allow for pregnancy. Therefore, people who are already in menopause or those who are absolutely certain that they don't want a future pregnancy would be good candidates for this procedure during a planned surgery. It's important to understand that removing the fallopian tube is permanent and cannot be reversed. Because some people may experience regret afterwards, you should be completely certain that you don't want any pregnancies before proceeding. Since the overall lifetime risk of ovarian cancer is relatively low for most people, surgery is not recommended solely to remove the fallopian tubes for cancer prevention. However, if you're undergoing surgery for permanent contraception, complete removal of both fallopian tubes is recommended rather than a tubal ligation. Additionally, if you're already having abdominal surgery, like removing your gallbladder or appendix, it may be a good opportunity to remove the tubes at the same time to reduce future cancer risk. People who carry genetic mutations such as BRCA1 or BRCA2 should discuss options carefully with their doctors. For them, current recommendations typically include removing both ovaries and fallopian tubes because their cancer risk is significantly higher. For people without these mutations, though, removing the ovaries is not recommended before menopause because this would cause early menopause and may lead to long-term health problems.
Opportunistic salpingectomy is a very straightforward procedure. We do a lot of our surgery laparoscopically, and so we could easily look at the fallopian tubes without difficulty. It only takes 5 or 10 extra minutes, and if it gives us the opportunity to reduce the risk of developing ovarian cancer, this is well worthwhile. Occasionally, when we look in your pelvis, the tubes cannot be safely accessed due to scar tissue or other factors. If that happens, we will not be removing your tubes.
Removing only the fallopian tubes does not appear to affect hormones or long-term health. It does not cause early menopause. However, it will prevent natural pregnancy. If you plan to become pregnant in the future, this procedure should not be done.
If you are not planning future pregnancies or are already in menopause, talk with your surgeon about whether removing your fallopian tubes during your upcoming surgery may be right for you.